Hi everybody, this is Rhys Barber from Audiology Associates. Happy New Year to everybody. I apologise for not doing some videos for quite some time. We've been setting up a few new clinics. What we have for you today is a bilateral earwax removal. This client has been attending clinic today because they've been having some discomfort in their ears. The local GP hasn't been able to get a good look in there to ascertain whether we're looking at infection, so they've asked for us to remove this wax so they can get a good look in there. What you can see us using here is a standard size Zollner tube. Being very gently just applying a bit of suction to this this wax sort of blockage and plate here. Our patients are not anaesthetised in any way, so there's no local anaesthetic. They're fully awake and aware while we're doing this. So because this patient's already had some irritation, we don't want to go making that worse. So we're doing very gently with this ear. So remove the first section. You can see it's pulled some softer wax with it as we took that first section away. So we're just removing those pieces. All from the outer part of the ear canal. We're very lucky as we're taking that wax away more as we can pull forward. And there we are as well. Now as we go in for this shot now, you'll just see the eardrum just behind this last section of wax there. So we're just removing this last piece of wax. And when you take a look at the eardrum should normally be very smooth, pearlescent in colour. You can see it looks very mottled, very aggravated. A little bit of pressure coming in from behind it, so a little bit of bulge to the eardrum. The pressure is normally from usually a fluid sitting behind the eardrum, so it can be middle ear fluid, it can be start of infection. It's very difficult to see from this side. This is the second ear we're doing now, same patient, and you can see that we've got some very wet wax in here. The patient's been using some drops to help to ease some of this irritation and aggravation they've been getting, but you can see just how much of this is getting sucked into the machine. Very soft wax, just encountering a little bit of skin here. So we're just lifting that a little bit. So we've got a bit of wax with a piece of dry skin, and there's a little tiny bit of wax on the cilla, which is just getting in the way of the camera a little bit there. But there, you can just see this piece of skin that's lifted up. So we're just going to try and remove this now. Just trying to get a good grip on it. It's difficult sometimes with skin to get a good grip on it to get it out in one piece if we can. So there we are, just hoovering up some of the little bits of debris. Just getting rid of that annoying piece of wax. It keeps getting in my view. There we are. You can see this section now. See, it's much wetter, much sluffier skin and debris in here. There we are. It's all starting to lift away, getting pulled away. Now this has been sitting right next to this this patient's eardrum here. Taking this last piece away. Now what you can see when I take this last piece away now, if you take a look at the eardrum, you'll see in the top right hand corner you almost get this red circular bulge. That's actually the top of the malleus. That's the top of the hammer bone sitting behind the eardrum. So very distended, very pushed out. So yeah, this client needs to get some treatment from their local GP. Thank you very much for watching, guys. If you enjoyed the video, then please like, subscribe, and we shall see you for our next video soon. As always, take care.